like to call to order Public Safety Committee meeting for April 21st, 5:30 PM at Council Chamber Room. Approval of minutes. I don't know if we can approve them. I wasn't at the last one. Or was I? Oh, no, we
let's see.
canceled the last one, so
But we're talking about the minutes from February.
February 18th.
We were both there, so I
We
move
were.
to approve.
I'll second it. All in favor?
Aye.
Aye. Open for the public. This portion of the meeting is specifically set aside for comments from the public. Anybody's asked to only speak for 2 minutes. Any interesting people? I don't see anybody here. Unless Deputy Chief's speaking? No? Anybody on emails? Nothing? Okay. We'll go to departmental updates. Fire.
All right, thank you. You have our executive summary, but just a couple other items worth mentioning. And because we didn't meet last month, I've got a couple of catch-up items here. But to start with the highway, February was a very busy month with 15 calls in 28 days. I checked my records, and we had the same conversation in February 2024. It was just as busy. Slowed way down in March with only 2 responses, and the same goes for April so far. So with that said, as for responses, we are up about 17% more than we were at this point last year. No one particular item. The other item I wanted to mention is that 11 of our firefighter 2-level candidates passed both their written and practical exams and are now certified. 2 members had scheduling conflicts, and now they're scheduled to take the exam in about 3 weeks. We also had 1 member complete Fire Officer Level 2. We also anticipate beginning our Firefighter Level 1 certification courses shortly after July 1st. And lastly, I want to mention that one of our members shipped off to basic training in the Air Force last week. Jaden Reyes enlisted in the Air Force Reserves. He'll be gone for about a year, and he'll be back after that. And we wish him the best of luck. And his dad is Jerry Reyes, one of our longtime members.
Great.
And I stand ready for questions.
Counselor?
I don't have a question, but I do have a comment. Chief, I noted it in today's Hartford Current, an article about statewide difficulties in recruitment for fire departments throughout Connecticut. And it just makes it all the more impressive what an outstanding job you and your colleagues have enjoyed with our department on the recruitment front. So particularly when other towns are finding such a challenge. So tip of the cap.
Thank you, thank you. I do want to mention I was misquoted in that article. And my point I was making with the reporter was, forget the big elaborate measures, start simple. Lawn signs. Let people know that you need help. And she asked me what kind of lawn signs, and I said, well, like you see at election time each year. I'm not sure exactly what she said in the quote, so if I offended anybody running for election, I apologize, but that wasn't the intent.
None taken.
Okay. All
None
right.
taken. No, you've been doing a great job with that. I see you've
Thank
still
you.
got it on a little hold, the recruitment, but that's great. You've
We
got
are,
enough.
we're probably going to relax the recruitment hold for the south end of town. We want to put more people into Company 3, which is on the corner of Main and Old Forge. We need some people there. New Britain Avenue and Old Main Street, they're doing very well. We are looking at 2 retirements out of New Britain Avenue in the next few months, 2 long-term members. But I think where we are, we won't miss a beat with them retiring, and we wish them luck. One guy, 40-something years, he did his time.
That's for sure. Did a great job. I was just looking at, like you said, the response is 91.
Yes, sir.
Are we generating $1,500 a call?
Yes, sir.
Did that go up? I don't remember it being that high.
No, The way the statute reads is it's $500 for every company that is called to the highway.
Oh,
Even if
okay.
you're canceled en route, you still submit the invoice. We send 3 companies, just for the safety factor with blocking, et cetera. So 3 times 5 is the 1,500.
Correct. Okay, fantastic. That's it. We'll go to you again, emergency management.
Okay. All righty. Okay, again, a little catch-up from last month. In March, we tracked an apartment complex with a partial water loss. We had 8 buildings on Marshall Road that lost water. And boy, I tell you what, MDC was on their game, and they got the water back in about 6 hours, and it was a broken cast iron pipe, underground pipe. And it was on a Saturday morning, so we went down there and just made sure everybody was okay, did the welfare checks, worked with the PD. We've also met and refined our notification plan with Eversource. And with the assistant of Chief Clef's staff, we've looped in the dispatchers so that we're all on the same page. And now to complement the Eversource policy, we're currently finalizing a notification policy for both internal and external notifications, whether it be CNG, MDC, Central Connecticut Health District, facilities, highways, human services, et cetera. So we're putting that all together right now. Worked on it for a while today, and I got to tell you, the more I worked on it, the longer it got. So it's going to be a fairly all-inclusive policy. And with that, I stand ready for questions there.
Counselor
I'm here,
Sullivan?
thank you.
Thank you.
We talked in the past about, with the ambulance, the camera and the new key fobs. Are you not handling that, or is it gone to the town?
I'm not handling that. That is with Phil Sear.
Okay, thank you. All right, ambulance. Any reports? Rocky Hill first?
Do you want me to go first?
You can go first.
Over February and March, we've had a change in numbers. February, we had 64 total calls. March, we had 95, so we had a nice jump in calls. We've been able to not freeload off of Aetna. I kept calling it so much. We were able to start using service to help exit stuff and get back into control of our own again. So we have 95 calls and 21, what was the number? I just scratched it out. 21 cancel refusals out of 74 transports, which is a nice number to have. I like that a lot better than what's been happening. Took delivery of one of our ambulances in March, and I've been working on getting that on the road, working with OEMS and with the state and with some suppliers to get some upgrades and get some things on board to get things ready for that. Getting an ambulance online is a bit of a challenge, but I'd like to have it online by the end of April or the beginning of May.
Is one coming offline?
Yes.
So
The
you'll
old
have
372, the old big blue and white box that we have.
that 2 or 3 that you'll have?
We'll
Once-
have 3.
3.
We're replacing one.
Thank you.
That's where we're at. Not a lot, but a lot.
Counselor Sullivan?
And we did also have, see, this has been, when we go too long, I get lost in my own shuffle. During the month of February, we did a huge campaign for February's Rare Disease Month. And we have one of our members who's training right now to become my deputy chief because Kim is stepping down from that position. Haley Wetmore has We have a huge campaign that, I don't know if you've been seeing, the Hope for Haley campaign. Haley has OEIS, which is a genetic disease. We've been doing a lot of media campaigning and a big patch drive. I've been at the post office basically every day. So, in which we have collected thousands and thousands and thousands and thousands of patches from across the globe. I have been wholeheartedly, completely and thoroughly impressed. And we have the happiest 4-year-old in the world. She's she's coming back from Boston today. They had a runner in the Boston Marathon running for them that's raising funds and money. She'll be going in January, hopefully, to have reconstructive surgery. And it's a 2-month-long intensive care surgery that she'll be enduring. So we're trying to support Haley, and we are also currently, if you go down to the building, inside our hallway, there's a sign that we're asking all of the Rocky Hill members and residents, personnel, to sign for her, to support her. That's going to go in her room when she is up in Boston. So anybody's welcome to go down and sign it. Appreciate it.
Nice. Counselor Sullivan, anything for the
Any
Rocky
questions?
Hills
Should I
side?
Dave's report and then just do it jointly, or,
Whatever you'd like.
okay. Well,
If you have anything for her?
yeah, so you mentioned that like a 50% spike between February and March. Any particular drivers of note for that increase, or is that just statistical noise?
I don't think that we've had an increase in call volume at all, like from a dispatcher, police issue. I think it's just a shift as it going from, Aetna was picking up the slack, and it's now back in my department. That's all. We just,
Okay. So I think it might be smarter to have both of you do your reports first and then do the questions. Because when you aggregate your figures, you're saying you didn't have that big bump then. Is that sort of?
no, it wasn't a bump in the sense of there's nothing wrong in the town. Okay.
No, they were able to take more of the calls instead of referring them to that.
Understood, okay, thank you.
No questions, right? Thank you.
Are you sure?
Yes. I'm still absorbed.
I gotta
in the
make sure you're on
material.
your game,
Yeah.
that's all that was.
Aetna's
Thanks for
report?
checking.
You're welcome. All right, let's see, let me get here. So for the month of March, we had 293 responses for a total of 224 transports, bringing us up to the year of 963 responses with 705 transports. To answer Counselor Sullivan's question on the total responses, the combined for March was 338. Looking at the 9-month average I have, it's around 320, so it's just a slight up. Kind of leveled out. January was a pretty busy month. That was our highest that we'd seen in the 9-month period, and that was about 392 for both agencies. I'd be remiss to not thank Chris Campanelli. He's been helping quite a bit with the consolidation. He's one of Chief Collette's dispatchers. He's been helping with the consolidation of that data so that I can kind of a little bit easier to see how many unique responses there are, and gets rid of some of that duplication that we were seeing earlier, and also gives us an actual number to work off of and trend for the future. So very appreciative of his work doing that. We have been very, very busy with our training. We had 3 paramedics just clear, actually 1 today, from their precepting process. Paramedics Blaze, Mendez, and Gauthier. Paramedic Gauthier is actually coming back. He's an ICU nurse, so we're really thankful to have him back. We can utilize him for some critical care training and some other things. So he thinks he's coming back to get paid just to be a paramedic, and joke's on him. I'm going to make him do some more stuff, but we're excited about that. In February, at some point, we did update the Charlie response code, which it's probably just at a high level. Basically, it's just if it's just a single ambulance responding to an incident, to something like a stroke. They had been previously dispatched on a cold response. Now that's changed that to get a hot response, so the citizens should be seeing a quicker response time to some of those emergencies. That was a collaborative discussion between the police department, the hospitals, as well as RHVA and Aetna. So far that seems to be going pretty well. Our average response time is 6 minutes and 25 seconds, so right around what we have been, but, you know, we may see that kind of come down, because that is going to capture some more of those responses that might have been on a cold response are now going to be on a hot response, which hot meaning with lights and sirens, cold meaning no lights, no sirens. We did have 3 cardiac arrests last month, and none of them were transported. Unfortunately, we did have 1 opiate-related encounter that was a positive encounter that we were able to resuscitate, and that was, I actually think there was bystander Narcan given on that one. We are monitoring another cardiac arrest that happened in this month. We'll be able to provide some more updates on that hopefully next month, but it does seem like that was going to be a cardiac arrest save, and hopefully we'll be able to get some appreciation out to the officer who was on scene and actually transported on board with our paramedics to the hospital. So good stuff all around. With that, that really brings me to the end of my report, and I stand ready for questions, and if there's combined questions, we can do that too if that's easier in the future. Whichever is best for you. I am here for you guys.
Very good.
None here, thank you.
You're welcome.
I don't have any, for a change. I hope it's a pleasant change.
I'll just
Thank you.
ask Rocky Hill, how's your recruitment? The fire department's doing well, your numbers
We
increasing?
are starting a class, we're starting an EMT class this week, next week? This week? I lost track of time. I've been in the shed all weekend putting a truck together. This week, I think it's this week. And we have 9 people starting the class, 9 or 10. So I'm hoping that that'll be a beautiful thing. And hopefully at the end of all of that, I'll also have my teaching time that I need, that I've been dying to get. So I'll be getting my EMSI finally. I've been working on that for the last year. So hopefully, at least at worst case scenario, I'll walk out with a credential. So that hopefully is going to be happening. And I'm hoping that I think there's several people right in town that are actually going to be in the class, so.
Great.
And several people from Newington. We've been trying to kind of pair up with Newington EMS to try and work together to collaborate, so.
Thank you. You want to take over?
I can do that.
Sure. Police.
We'll move on to police.
Good
Thank
evening.
you, thank you, Councilor Whelan. Thank you.
Just before I get started, just make an announcement. We have a DEA National Drug Take-Back Program on Saturday, April 26th, at 10 to 2 outside the police department in the front cul-de-sac. So if you are interested to get rid of any of your prescription pills, drugs, et cetera, that program will run there from 10 to 2. It's been very successful in the past, and we encourage you to clean out your cabinets and stop by and pay us a visit. You have my summary. I will point out 2 things in particular, or 3. I'm very happy with the way that data is working out on the chart for the calls for assistance and emergency response. If you notice how I broke that out back in January. And I'd steal your word, Dave, like the duplication with the original chart of calls for service, really what I was finding was that it was being affected by the number of officers on the total full-time staff, how many people are on the road, can be affected by days off and things of that nature. So that calls for assistance and emergency response, just to remind you, really is that breakdown to get rid of some of that duplication is really the closest I can get with the data that we have to give you a real monthly number of calls for service that are coming into the department and generating a dispatch from the center. So it kind of cuts out the proactive work of neighborhood checks, et cetera. That's included up in the regular calls for service. But I think over time, as we watch those trend lines move, it is telling us an interesting story, at least for me, that you're noticing that we had some questions in previous meetings about why we're seeing a reduction in the calls for service in that main chart. And now with the assistance and emergency response chart, you're kind of seeing that continuity amongst the data, which I think will give us a better picture over time. But it's starting to work out nicely, and I'm happy that it's there. I hope you are too. As far as hiring right now, we actually are just completing 2 background investigations on 2 certified lateral transfers, one of which we should be making contact with this week with a anticipated start date in the next 2 weeks or so, with a third not far behind there. And we have one of our officers who had graduated from the academy is coming up on the last phase of his training, and should, all things looking good, that'll be on his own within the next couple weeks to a month at the latest, if all things stay on track. And as far as incidents and things about town, We're seeing, it's a gentle spike. The data's not jumping off the chart, but there's been a little bump in the retail theft for 80 Townland Road and Big Y. Digging into that a little deeper, it appears it's a couple repeated cases, recidivism. Same suspect gets caught, identified, and gets logged into our CAD as kind of a repeat visitor, and 2 cases get generated. So by no means are we seeing a spike in crime. Some of that is just the same name kind of duplicating another case and another investigation. So that's what I have for you for the summary, and I stand ready for questions.
So Chief, on those are your repeat offenders with a relatively small larceny, shoplifting, and the like, there was a lot of talk, some jurisdictions reduced the dollar, or I'm sorry, bumped up the dollar amount before a felony kicks in, and so you had increases in misdemeanor retail theft in certain places. I'm not talking about in Connecticut, but elsewhere. What you just described is some kind of frequent flyers in some of the retail stores getting arrested and then rearrested and the like. Can you tell us in general how those are treated? Is there a certain point where multiple, low-level dollar amount offenses like that get the prosecutor's attention and then, ramps things up to be a little more severe?
So the level of larceny is really dictated by statute. So 500,000, there's incremental steps in that. So over a certain dollar amount would require a different level of charge. But also you have the store policy. So what we see is some of the stores are bringing in loss prevention and more likely to make identification or make a complaint. And then for us on the discretion level, generally we're looking to the complainant to make that decision. If we're talking about a stick of gum, we might be able to work something out. But for the most part, we're leaving it up to the proprietor to make a decision if an arrest is warranted, and we would pursue that. Going back some years ago, the court used to gently suggest, maybe don't bring us to small cases. But that's where we're seeing that, people coming in and stealing small level things. So we really work with the vendors to determine what direction to go and how they'd like to handle it, and then present that case to court and really leave it up to the GA to determine if they want to prosecute or not. Hope that answers your question.
It does, thank you.
Just with your hiring, are we getting towards full strength?
So with the 2 I mentioned that are currently in background, that first person coming on will actually fill the vacancy created by the retirement by Lieutenant Gutzfeld, which puts us back to 41 overall on the full-time employed. And then we have the next position for 42, which would be the next officer, which again, so 41, 42, those 2 will complete our books for full-time staffing.
Great.
As far as the payroll is concerned.
Right, great, thank you. So,
Yeah, quickly, just for purposes of reminding everyone as a refresher, why are we doing 2 numbers on the total cases like you described? What is the advantage for you in terms of looking at the data those 2 ways?
Well, it really stemmed from our conversations here, because what I was noticing and you were noticing was from that calls for service chart was really being driven by the overall number of CAD entries that were being placed into the CAD system.
Correct.
So I don't want to call it duplication because it's not, but what I wanted to be able to show you was the real calls coming in that are generated by the public, not the proactive nature of our business, which is more than 2/3 of what we do is really the proactive motor vehicle stops, checking neighborhoods, business checks, and going about our general business, which is the most important part of our work. But what it's really showing me is we're looking at what's going to help show me is as these number of apartments come online, we have 625 apartments coming online in the next 2 years. It's going to show me that data line should be able to kind of follow that and seeing what kind of demand it's putting on us for reactive calls, for calls that are coming through the center and generating a response for the police to report to. Much like the ambulance, it's in fire, those are generally reactive numbers, right? If they get 10 calls, we can have 300 numbers and 10 of those are reactive numbers. And I want to give you the best view of the data that I could offer you.
No, thank you for that. I know it started here. I just wanted public to know why we are doing something. And that was a really good explanation. Proactive versus reactive, probably that's what those 2 buckets are. So thank you. I just wanted to make sure everybody understands why we're doing certain things differently, right? We are still tracking the old way, obviously, but we have a new way where we can have a better idea of like where we are spending the time and what's the proportion, right? The
We
weighting.
could spend, I could give you 10 different charts just on the proactive, reactive data. I'm
Right.
just trying to consolidate it to 2. And really, and for us as a growing organization and a growing town that we have to react and respond to, I
Right.
want to be able to show that trend line over time, in particular with the expected growth that we know is coming.
Okay, cool. Thank you so much. Moving on to, who do we got next? We got the health district,
Or not? No report, they say.
or not?
He's not joining.
Today.
Okay. So there is no old business, there is no new business, there's no other business. Ray is not here, but Mona is here. Any other business?
No
Mona?
other business.
Okay, so I'll motion to adjourn.
I'll second it.
All in favor?
Aye.
Aye.